All right, we are back once again on the Lightning Step Couch here at Global Exchange 2023. I am sitting with Dr. Marlon Rollins. He is the president and COO and a licensed therapist with Renewal Health Group based out of Los Angeles. Dr. Marlon, thanks for joining us today.
Thank you for having me.
Really
Really
great
appreciate that.
talking with you. Tell me a little bit about yourself and what Renewal does.
Absolutely. Thanks again for having me. I think
Yep.
it's really great to have these kind of conversations here at this conference. This is really what it's all about.
Absolutely.
So again, I'm President and Chief Operating Officer of Renewal Health Group. We're based in Los Angeles, California. We specialize in residential mental health and also drug and alcohol treatment for detox residential, and we do outpatient services as well for stabilization. So prior for me to coming into the role of Chief Operating Officer with Renewal Health Group, I worked for many years in the emergency department, working with police department, working with fire and crisis services. I was a director of operations for an inpatient psychiatric hospital, as well as the crisis department, which was like an emergency room for mental health services. So doing the work and then leading teams to figure out how we can respond better to people when they're having a mental health crisis is really what it was all about, because that crisis point was really the pivotal point of whether or not this person was going to really make a change. So with Renewal, for instance, if somebody's coming into our services, usually there's a stabilization from the acute side that has been somewhat stabilized. And so I found that crisis services were absolutely key because that was the pinnacle of deterioration when somebody was struggling with their brain health. And so the fundamental principles of understanding what to do, how to do it well, was absolutely critical because that changed the trajectory of whether that individual would engage with the behavioral health system or not. Right. So that's why it becomes so key. Everything else becomes, build upon that
Secondary
one experience.
or build
Absolutely,
upon it. Yeah,
absolutely.
absolutely.
So for me, my personal mission was really to make sure that we understand how somebody is not well, supporting not only them, but their family members, because they're scared. They don't know what to do. You know, think about any medical emergency, right? Somebody has a stroke, somebody has a heart attack. It's an emergency.
Absolutely.
How do we understand that with mental health? What do we do for that individual in the emergency, and what are we doing after the fact?
Awesome. How did you get into this?
Honestly, it was a calling for me.
Okay.
So I worked in the ministry for a number of years. And if you work in the church setting, usually the healthcare system in some regards has failed.
Yes.
And in some regards, the church is not the most famous place to get mental health or drug and alcohol treatment, but it was a place that people went to because they felt safe. And so I got my license as a mental health provider, working in the church, helping people, helping families that didn't know what to do. So it became a safe space because for the first time, they may or may not had an experience with the church in which they could get professional help and professional guidance.
Absolutely.
As opposed to, oh, this is like demonic possession or something like that.
Yep.
So that was really what started it for me. And I got my doctorate and master's degree from Ball State University in Muncie, Indiana, counseling psychology. And from there, I decided I wanted to move forward in leadership. I lost my sister to suicide almost 10 years ago.
Sorry to hear that.
Her name was Amber. Thank you. And she was a nurse. So as a healthcare provider, as a licensed provider, I wanted to raise my hand to be able to position to do more and to understand what it means to have lived experience and lived expertise and put those two things together.
Absolutely. That's a beautiful story. Again, sorry to hear about your sister, but we're glad that inspired you to be where you are and to be helping other folks. Let me ask you, what warning signs indicate that a patient may be in crisis or at risk for harm to self or to others?
Yeah, absolutely. So really important question, and again, I always try to educate people, just as like any other disease course, you need to know the warning signs when there's a problem. Just like if you're diabetic, if your blood sugar's out of control, you're going to be urinating, your blurred vision, those kind of things. If you're having a stroke, you're going to have slurred speech, you're going to have some type of difficulty with movement, the slouching of the face. So knowing the warning signs. So like for instance, with suicide, I really teach this acronym called Death Wish.
Okay.
And it's really, you won't forget that. Do you have a death wish? So what it really stands for is the D stands for depression. So having depressed mood, assessing for that, specifically if the person's having thoughts about wanting to end their life
Mhm.
around like, I don't want to wake up anymore. I'm tired of feeling like this. They're having a hard time getting out of bed every morning. So the mood state they're having extreme mood swings, the E. A, they've got a lot of anxiety and really agitated. They're on edge all the time.
Absolutely.
Feeling trapped, the T, like I can't get out of the situation. Hopelessness,
Yep.
the H, talking about, oh my gosh, things are never going to get better. And then we get into the wish. So death wish, wish meaning W. Okay, now I'm withdrawing from other people. I'm isolating. I used to engage with other people. Now I'm pulling away, right? Ideation, which we know we talk about.
Mhm.
People might make statements saying, I don't want to be here anymore, right? I'd rather, be somewhere else, writing notes. So we can find somebody writing a note about something or drawing pictures of
Mhm.
death that could be harmful to other people. So they're thinking about it, they're drawing, they're writing about it. The S, substance use increase.
Absolutely.
So now we're using more drugs and alcohol because someone's trying to numb the emotional pain. And of course, history, H, meaning history of attempts. So whenever you see any of those warning signs, that's when you can go and ask somebody, have you thought about wanting to end your life? Are you in a crisis? Now, when you're talking about other mental health crises, especially with somebody who's having, like, say, a manic episode, disorganized, rapid speech,
Mhm.
they might be hearing voices, having delusions, paranoid talks, that kind of thing can be very scary for the individuals. So in those situations, when you're seeing warning signs like that, it's always a good die. If you're my friend
Yeah.
and I see you acting that kind of way, I should ask those kind of questions.
Absolutely.
I should expect that you might be kind of defensive about it.
Yeah.
If I'm not sure what to do, pick up the phone, call 988. Remember, it's the suicide life prevention lifeline, but they can help you wherever you're at, deploy a crisis team if there's an emergency, and you can get questions as the person helping the other person to find out what to do. And a lot of people don't know that.
Yeah.
You can call that line. It's free, it's confidential. The police are not to come blazing out to your house. Do that first, and they'll give you guidance on what to do next
Yeah.
to help your loved one when they're in a crisis. Think about 911, just think 988 in a mental health, behavioral
Yeah.
health, brain health emergency.
Absolutely. And that's great to clarify that 988 works on those levels as well.
Yes.
And that's great. I appreciate you clarifying that. Um, what safety planning strategies can help prevent a suicidal crisis?
Absolutely. And the same thing with a homicidal crisis as well. So safety planning is really about collaboration. We think we got to quickly lock this person away.
Mhm.
Like, I want to still make sure that I serve you with integrity and dignity. If you were in a physical health crisis, I wouldn't call the police on you,
Yeah.
right, and have you locked up, right? So having a safety plan that's collaborative with you, like, I'm going to go with you. Like, I'm concerned about you.
Yeah.
I'm going to still be present with you because it's scary now. So I might call 3 or 4 other people to also get involved. Like, hey, who else can we call? I'm concerned about you. Maybe it's your mom, it's your dad, or whoever it is that's
Mhm.
going to be supportive. Could be a teacher. Whoever you're okay with coming along. I'm having a hard time doing it all by myself.
Yeah.
So having a collaborative safety plan. The other thing that is most important that you do is make sure that you don't have access to anything to hurt yourself
Absolutely.
or someone
Mhm.
else. Is there any drugs in the house that you could overdose on? Get those away. Are there weapons in the home? Is there a gun that's not been locked up? Get all of those things that a person that are lethal out of the reach of that individual until they're through that crisis. If you're concerned about a weapon, call the police, explain to them that I've got somebody I'm worried about, and they will, in many states, will keep the weapon for you
Yeah.
until that person's cleared. So again, if you really want to avoid the suicide from actually happening, make sure that you get rid of a lethal mean. Because
Yeah.
it's okay for somebody to be thinking about it, feeling it, but it's a different thing when there's a
Yeah,
weapon
right.
within
Yep.
reach.
Absolutely.
So those are really the important kind of key things to be doing. And again, remember that if you're trying to help someone, it's okay for you to be scared too.
Yeah. Yeah.
And they're probably going to say, hey, don't tell anybody. Like, hey, I'm scared. I want to help you. Let's call in help.
Yeah.
Call 988. Find who can you talk to help create a safety plan together.
Absolutely. It's one of the most difficult moments and most crucial moments in somebody's position like that, to have the support
Yeah.
and to be able to have those conversations. Let's shift a little bit to technology and innovation.
Mhm.
Okay. How do you utilize technology, and what role does that play in supporting people? What are you doing within your organization with technology?
Absolutely. So technology is key, and you have to deploy it. Like, here's an example. Like, okay, 988, for instance,
Mhm.
is a form of technology. It's a phone call. Another thing that people have on their cell phone is you can actually say into Siri, like, I'm having a mental
Yeah.
health crisis, and Siri will respond.
And people don't understand that either. They don't realize that. Yeah.
Yeah, and that's an available resource. So there you have, it's almost like a integration of technology. You're saying these words and they're going to help you. It's all built into social media, but also telehealth services are key. So for instance, I at one time worked with the fire department. So a lot of people feel good about the fire department, but maybe not so much about the police.
Yeah.
The one thing that people don't know about the fire department is when they're deployed to an emergency, they can do what's called a medical clearance, right? They're not going to be an authority to arrest you,
Mm-hmm.
but they can do a medical exam in the field. And they typically have technology on their persons where they can do telehealth assessments.
Absolutely.
So again, using technology like that in the field, when I was running crisis departments, we had telehealth services that would connect them with therapists who were not readily available to come in on site, to do it over a teleprompter, to come up with an assessment, to
Mm-hmm.
staff the case with a psychiatrist, to make quicker decisions, easier in the field or at the point of care. So that's where technology really comes in. Instead of waiting for somebody to come, you can literally get on,
Yeah.
a telehealth service and get access immediately to the help that you need.
Mm-hmm.
And of course, we've got medical record keeping and all that kind
Yep.
of stuff, which is
Absolutely.
absolutely critical to make sure we're keeping track of the person's care, discharge planning, the whole 9 yards.
Yep.
So again, telehealth services has changed how we provide access to help, especially with limited resources, and the way that we document and integrate care communication between all the providers that are going to be involved in helping you get back to a safer
Absolutely.
place.
Yeah. So where, if anywhere, is technology falling short? What would you like to see done better?
Oh wow. To making sure you can hardwire things around privacy. I think
Mm-hmm.
that's always the piece that
Okay.
we have to do more around, making sure privacy is set up properly. Honestly, I do believe that AI is an opportunity. And what I mean is, if
Absolutely.
somebody's talking about it, feeling it, looking at somebody and
Mm-hmm.
seeing signs, changes in behavior, recognizing that, like if I could get on a teleprompter and I can see that there's a difference in how this person appears, I might see changes in their pupil dilation, how their behavior, their slurred speech, whatever, to become indicators, or what they're saying might deploy other questions to be asked to try to communicate to other providers. So I think there is an opportunity with AI to help with more integration and signs and symptoms of somebody, to make sure we're doing it. Let alone the sensory stuff that can be
Yeah.
used for relaxation. Let's get into the treatment
Mm-hmm.
modalities. There's a lot of work that's being done around for the recovery side of it,
Yeah.
making sure we're using technology. And we do that at Renewal Health Group, actually, using a lot of technology,
Okay.
sound healing, all those kind of things, vibroacoustic therapies, etc., are at our disposal. So it's really great to see integration of technology to provide treatment for people. Brain scanning, the whole bit. Um, TMS, it's been around. So all
Absolutely.
those things are
Yeah.
technology, right? And
That's
being able to
great.
do it quicker, better, because you can do,
Mm-hmm.
like treatment through a virtual.
Yeah, absolutely. Yeah, we've chatted with a few folks that are doing some very specific things with compliance and specific topics that traditionally have been handled in-house, like
Yeah.
compliance, having somebody, just on your staff that handles compliance. But
Yeah.
we're seeing there are now organizations that are more skillful at that. Are you embracing those things at Renewal? And how is that difficult to make that transition from letting somebody else do that?
I don't think it's difficult, because you want to make sure you're using people who have mastery in it,
Hmm.
right? When you're focused, as Renewal, we're focused on treatment. We're focused on making sure the quality of care is really good. People don't think about the back end. So if you've got a professional technology company, if you will, that you can bring in who has mastery around that
Yeah.
can help protect privacy, that's always to the benefit. Um, it's kind of like billing services. Like sometimes there's people who are professional billing. So you bring in the experts who
Absolutely.
understand the needs, the regulatory pieces of it, the law requirements,
Hmm.
and they're on their job,
Yeah.
because trying to hire in a big IT department on top of a healthcare system is difficult. So I think it really comes down to leadership. The leadership understand the benefits of technology and the risk that's taken away,
Yeah.
and can protect the integrity of the patient experience and the institution, then you're much better suited to provide care, because everybody needs to feel safe about what's
Absolutely.
happening as you're
And we
moving
need to
clients.
free up, our clinicians and our staff to be able to do what they're there to do
Yeah,
and not complicate those services. So let the experts handle the technology,
yeah.
let the clinicians do their job. Dr. Marlon, is there anything that I've missed in our conversation today that you really want our guests to hear about?
You know, um, Again, thank you so much for doing this.
Yeah.
We covered a lot of ground here. The thing is, I just want to make sure that people have access to the help. That's
Yep.
the one thing, is to reach out, to get online, check for, questions that you have. There's a lot of great information out there too. So I think we covered it all here today.
Good, man, good.
I hope people will
Yeah.
find this helpful. Thank
Yeah.
you for what you're doing. Again, thank you for
Yeah,
having
well,
me. Really
you
appreciate
thanked
that.
me, man, but I got to thank you. Again, we've got Dr. Marlon Rollins here, president and CEO, and also a licensed therapist. He's running Renewal Health Group out of Los Angeles, doing great things for the community there. Doctor, I
Thank you.
really
All right.
appreciate your
Yeah,
time.
yeah. And COO.
COO.
COO, it's all good.
Okay.
And Monterey Behavioral Health. That's our mental health side. So
Thanks
those
for
are the two
clarifying
programs.
that
That's
for
all
me.
good.
I
That's all
appreciate
good.
it. All right, guys. Thanks so much.